and welcome to GOLD Lactation Online Conference 2014. I'm Fiona Lang-Sharp, IBCLC and Public Relations Coordinator for GOLD Conferences. I'm here today with Dr. James Murphy, and he is going to be presenting at our conference on the topic of the diagnosis of Ankyloglossia and its significance throughout the lifespan. Hello there, Dr. James Murphy. How are you today?
Hello, I'm doing just great.
Great.
Hope you are too.
I am indeed. It's a beautiful day here. So I was just wondering if you could share a little bit of your experience with us today and let some of our delegates know what you're going to be talking about. Firstly, I would love to know how you first became involved in this work.
Well, I got interested in breastfeeding as a pediatrician because my patients kept coming in increasingly asking me questions that I couldn't answer. And I kept reading about it and studying it. Then I decided I'd join the Breastfeeding Coalition. And they told me, yes, we really want you here, but for our purposes, to help us, if you want to learn more about this, you need to become involved in the Academy of Breastfeeding Medicine, which I joined immediately and went to my first meeting in Tucson. In Chicago in 2003, the meeting included Kathy Jenna Watson and Elizabeth Carrillos, and they showed us the importance of the tongue tie with impairing the ability of the baby to breastfeed, and how common this was and how easy it was to fix, and it gave us marching orders to go back and take care of this. So I came back to my center, went to the ENT doctors. They agreed to clip some of the babies that I found, and then asked me, since I do chest tubes and umbilical lines and circumcisions and all sorts of things, why am I not doing this little snip? And then they had me do them, certified me, and then I've been off doing that ever since. And it makes a major difference. Releasing that fibrous band under the tongue, the baby latches so quickly and so easily to the breast, as long as we get them early in the first week. So it's very gratifying to be able to do a simple procedure that makes such a big difference in people's lives.
Wow, that just sounds wonderful. It sounds like you really tailspinned really quickly from your patients demanding you, and then with Kathy Jenna Watson there too, asking you to take it all back and get it sorted. That's phenomenal, just wonderful. So can you tell me, for our delegates listening, how will your talk support them and help them in their journey?
Well, we have so many people that are interested in lactation now that we have generally fairer resources for mothers to go and get skilled lactation help when that's all that's needed. But when more is needed, a surgical release of a lip tie or a tongue tie, it's a very simple procedure that every pediatrician, every family practitioner can do. And with my office that I have set up, I'll be able to have physicians come in, look at what I'm doing, see how quick and easy it is and what the major difference it makes. And little by little, I'm trying to act like Johnny Appleseed and create clones of myself everywhere to try to release these tongue ties and get these babies onto the breast early when it makes a big difference. And most of these babies then can go on to exclusively breastfeed.
Well, that's wonderful. It sounds like you're setting yourself up well to draw people in, and I know that in terms of, making this procedure sort of contagious in terms of, it's that easy, you guys should all be doing it, so that sounds great. So can you tell me, briefly you mentioned some of the outcomes that you are seeing, but can you expand a little bit on that and just let us know what are some of the outcomes that you're seeing from your work today?
We are working very hard with the baby-friendly movement to get all the hospitals certified as baby-friendly. And this means that everybody will be able to help a mother to latch the baby to the breast. That will be the expansion of our skilled lactation ability in order to serve the breastfeeding dyad right from the very get-go. For those babies then who are not able to, the next level is the skilled lactation consultant to assess and to find that there is tongue movement restriction, which can then be passed to the credentialed pediatrician or family practitioner or others who can do this in the hospital. It's definitely not at the level of ENT, it's at the level of family practice and pediatricians. So they can just confirm that that's there, get a simple consent form, snip that fibrous band, get that baby on. And we do this in the first week of life. We're going to be finding several billions of dollars of healthcare dollars are going to be saved because the babies are going to be breastfeeding exclusively and getting all the benefits of exclusive breastfeeding. So I have seen that in the first week we have over 95% success in doing this with our infants, but when it drops to the second week it can go down to 75%, and then in the third week thereafter it can drop much lower. So we need to have people identify and deal with this issue right at the very beginning of the infant's life in order to make this happen. That's my goal. That's, I guess you might call it my quest. A lot of people see me as Don Quixote, but that's something you have to live with.
Yeah, well, that's a wonderful goal to have, and you know, I'm just recognizing again the dollar behind this. It's fairly significant, and I appreciate you mentioning that because it's something that you don't see a lot of yet. But the truth is that of course if babies can't breastfeed, it's health dollars are a very big key factor to all of this. So identifying the ankyloglossia early and treating it seems to be have wonderful outcomes for, of course, our breastfeeding mothers and our breastfed babies. Well, we have run out of time today, but thank you for chatting with me. I'm really looking forward to listening to your full presentation, and I'm sure others will too.